talk to you today about 5 mistakes that patients make during the IVF process. We want to make sure that when you go through the IVF process that we've queued everything up and we've thought about every single step along the way very intentionally. So we're going to go through those 5 mistakes that I see all the time in my private practice. I'm Nicole Stern. I'm the founder of Fertilista, and I coach women just like you through the IVF process. First, the mistake that I see women make all the time is not doing ICSI. ICSI, that's intracytoplasmic sperm injection. So you meet with your reproductive endocrinologist. He or she sits down. They go over the labs with you and your partner or with the sperm donor. And they say, okay, we recommend ICSI. And you think, do I really need this? Is this something that I want to pay for? What advantage is this to me? I have to tell you, in my over 20 years of experience, if your physician recommends ICSI, you should seriously consider it. Because if there was nothing in the labs to indicate that you didn't need ICSI, your RE, your reproductive endocrinologist, would not advise you to pay for ICSI. So imagine you decide not to do ICSI and you get the medications, you start the stims, you do your trigger shot, you go in for your retrieval. They retrieve X amount of follicles, and then you get the phone call from the lab. The lab says, nothing fertilized. They didn't do ICSI. Imagine going through all that instead of just saying, yes, I'll do ICSI. It's a small part of the cost for IVF, and this is what I want to do. If your doctor recommends it, I would certainly give pause and think about what are the outcomes that you desire. And seriously think about adding ICSI into the upcoming IVF cycle. The next mistake that I see is that patients will not pay attention to sperm quality. So you meet with your reproductive endocrinologist at your initial visit and they go through the semen analysis. And they say, okay, sperm count, great. Motility, great. Morphology, it's 4%, that's fine. I have to tell you that in the wild, in natural fertility, 4% morphology, that is shape and size, is not going to cut it. It's going to be very difficult or take a much longer time to get pregnant naturally. And this is probably what has led you or is part of the equation leading you to the IVF process. Now, in IVF, in the lab, they can take that 4% morphology and find a few good ones to do ICSI. But if you pay attention to that number, instead of just saying, that's fine, if you put your partner on a high antioxidant formula and some fish oils, some CoQ10, a multivitamin, and make other lifestyle adjustments, you can see that 4% morphology increase up to 8-10%, which what we naturally see occur. The next mistake that I see patients make is that they don't pay attention to their TSH, their thyroid stimulating hormone. So, for instance, if your TSH is a little high or a little low and your reproductive endocrinologist advises that you take levothyroxine or Synthroid, one of the mistakes I see made is that then there's not enough follow-up before the IVF cycle starts to really watch what that number does. So even if you get one good TSH before your IVF cycle, sometimes it's not enough. If you've started your IVF cycle after you have a good number, then what you're going to want to do is every time you go in for blood work, you're going to ask the nurse to also check your TSH. So this is going to be after your retrieval. This is going to be after you get your positive pregnancy test. Keep an eye on it. TSH is very important. Now, the fourth mistake that I see that women can make is thinking they've been trying to conceive for a very long time and they have finally made a big decision to go for IVF. They've met with their doctor, their reproductive endocrinologist, and they've signed the contract. There sometimes can be a relief or a sense of, great, I've crossed that line. Now I'm going to be pregnant. Sometimes I have to tell you the very first IVF cycle is not a home run. You're going to want to set expectations. Because this is the first time you're going through IVF, your doctor is going to use it as a diagnostic tool. He or she is going to look and see, how did you respond to the medications? What happened in the lab? What happened at transfer time? And if it doesn't result in a positive pregnancy test, your doctor will then make adjustments. You want to expect that you should become pregnant within ideally 3 or 4 cycles. If it happens at the first cycle, that's fabulous. So you want to hope for the best, expect for a little bit longer, expect for 3 or 4 cycles. The 5th mistake that I see all the time happen with IVF is that either partner does not stop smoking or vaping. This is a huge, huge, huge no-no. If it's vaping nicotine or smoking cigarettes, this is a problem. It can dramatically affect how many follicles are retrieved if it's the female partner that's smoking or vaping nicotine. It can also dramatically affect semen analysis. In fact, some insurance companies that cover IVF will not cover it if there is nicotine found in the bloodstream of the male partner within 30 days of starting IVF. You have to keep your body clean. And I would say that even if you're vaping marijuana, set that off to the side. Don't do that now. This is very important. We want to see you have a successful IVF cycle. I'd love for you to share with me where you're at in your cycle, and I'd love for you to follow me so that when you need help, you know where to turn.